I am Alejandro Cruz. I'm a neurologist, and currently I'm the medical director for neurology in the neuroscience department at DHR Health.
Dr. Cruz, thank you so much for giving us some time today to learn all about the work you do here at DHR.
It's a pleasure. Thank you. Thank you for having me.
And so my first question is, can you explain what Leqembi is and how it differs from existing treatments for Alzheimer's disease?
Leqembi is the first disease-modifying therapy that is available now for Alzheimer's disease. So by that is one of a kind, meaning before Leqembi, all the medications we had was mostly for symptom management. There were medications to try to help with some of the symptoms that would come with Alzheimer's disease, but we really didn't have a therapy that could try to slow down the progression or the evolution of the condition.
And what led DHR Health to become the first hospital south of San Antonio to administer Leqembi?
Well, I think that's easy. It's our passion to help our community and our patients. I mean, we do what we do for our patients, and what DHR Health been trying to do since the inception of the DHR is to try to provide all the facilities, all the treatments that patients usually have to travel elsewhere. So for us, it was a priority to bring that medication to DHR to be able to help our community, because Alzheimer's disease is something that we do see very often.
And so can you elaborate on the comprehensive protocols developed here at DHR for the administration of Leqembi?
That is an important question, Steve, because it's not just a medication that you just give and that's it, right? This is not like taking an aspirin or anything like that. It is a medication that, first of all, we need to select very well the patient. We need to confirm that the patient is actually having Alzheimer's disease. Now, once we confirm that a patient has Alzheimer's disease, we need to make sure that the Alzheimer's is actually in the very, very early stages. After that's met, then we have to do some genetic testing to make sure that the patient will be safe with this medication, because as with many medications, there could be things that we need to be watching, adverse effects that we need to be watching, and there's a way to determine which patient might be more prone to that. Once that's done, we also have to be monitoring these patients. That involves MRIs that have to be done every so often. So our radiology department had to be involved. They receive training to be able to do the scans that we need and to detect the things that we need to be monitored in the brain MRIs. Our infusion nurses had to be trained on this medication as well. Our inpatient pharmacists, our infusion center staff, and of course also all of our medical staff had to be also involved, because these patients need to be registered in a specific registry that's built for them with Medicare, for example. We need to make sure that while they have the medication, the infusion center, they're being monitored for specific things. So it is a very comprehensive team or group effort that we need to do, and we're happy to say that thankfully we are trained and prepared to offer this.
Thank you for that. So what impact do you anticipate Leqembi will have on the patients here in the Rio Grande Valley that are currently suffering from Alzheimer's disease?
That's an excellent question. So what we saw in the clinical trial in Leqembi was that up to 36-37% of patients, the progression of the disease did slow down. So we're planning to see something like that. So if at 37% of patients is slowing down, that will mean that the progression of the disease will not be as fast, meaning that could be meaning to have more meaningful time with your loved one, right? By no means this is a cure, but this is just giving hope to our community. And by Leqembi now being approved and being out, there are already other medications that are being worked out, and this is just opening the door for more medications to come that might be able to help our patients.
Thank you. Next question, how does the establishment of a state-of-the-art infusion centre enhance patient care and treatment outcomes for Alzheimer's disease?
It is basically the way the patients are going to be receiving this medication. So you really need to do it in a place that they are trained on how to monitor this medication. You need to be in a place where you have access to physicians right away in case something happens. And of course, you need to make sure that they know the protocols. There are some of the infusions, for example, as we need, the patients need to be monitored, and for that monitoring, then there's some blood work has to be done, MRI has to be done. So basically, a checklist that need to be done. So they have to be a good communication with the neurologist prescribing this medication to make sure that the patient is actually ready. So they just don't go and get the medication, but actually someone that will go down the checklist, make sure all the boxes are checked to make sure the patient is safe to receive the medication.
Next question. What criteria is used for patient assessments before administering Leqembi, and how are those assessments conducted?
So there are a couple of them. First of all, we need to make sure that we confirm that the patient has mild cognitive impairment. So meaning when we hear about Alzheimer's, before we were just thinking someone with already dementia. Here, this medication is only approved for patients that have mild cognitive impairment, meaning the earliest signs of having Alzheimer's disease. So we need to confirm that the patient is not having dementia, that is having cognitive impairment due to Alzheimer's disease, meaning we need to confirm that the patient is in the early stages of Alzheimer's disease. Once we have that confirmed, we need to do that diagnostic testing to confirm Alzheimer's disease, which that's something that we arrange here at DHR. Then we need to make sure that all the testing, the pre-testing that is required prior to the medication is done. That's genetic testing that we have to do, imaging of the brain that we have to do. And once all that aligns, then that's how we can proceed to the medication.
Next question. How does the introduction of Leqembi align with DHR Health's mission and commitment to innovation in healthcare?
Our commitment is with our community. We want to provide the best therapy available for our patients, so they don't have to travel elsewhere to do it. As of now, I mean, I'm happy to say that right now the patients, they do not need to travel anymore to get this medication, right? So that's something that drives us here at DHR, because we do have this option for our patients to be providing them with the state-of-the-art facilities to be able to be getting all that diagnostic testing that they need, all the monitoring testing that they need, plus also having the staff and the medical providers to be administer and be watching this medication and the patients.
How long ago was it that they did have to travel outside of the valley for such treatment?
Well, it really wasn't for a long time. I mean, we're talking about just months, which is something that I think we're very proud of, because it was a team effort. It was not just one person. It was a combination of our neuroscience team with our administration team, with the infusion center. So we all worked together because we knew the importance of having this available to our patients. So I'm happy to say that we were able to pull this within months, which, you know, if somebody wouldn't have done their work the way we wanted to do, it would have taken years to get this done.
Next, can you elaborate on the potential benefits of Leqembi in improving quality of life and slowing disease progression for Alzheimer's patients?
So Leqembi is a disease-modifying therapy. So as I said, unfortunately, we do not have a cure, but a disease-modifying therapy is basically working on what you said. Is we're trying to improve patients' quality of life and the family's quality of life, because this is a condition that will affect not only the patient, but the family. It could be devastating to see your loved one like month by month declining. This medication will help buy time quality time for this patient. So this might mean that maybe someone that maybe will have, let's say, once you get diagnosed, maybe 6, 7, 8 years of having good conversation with the family, to have still some degree of independence. From those 6, 7 years, maybe to be 10, 15 years, right? Everyone is different, right? There are some patients that might progress faster than the others, so it might be the difference from being functional for 6 years to now 10, for example. So it does varies, but it is buying quality of time. And for what was seen in this study, up to 37% of patients, they responded to slowing down the progression, which I think, again, we want to see that number to be higher, but before it was 0. So it is good.
And now my final question, what educational resources or support services does DHR Health offer to patients and caregivers affected by Alzheimer's disease?
We have a whole team at DHR to be able to address this condition in a comprehensive manner. It's not only the neurologists, but we do have our neurotherapy team, for example, that can help us sometimes doing some cognitive therapy. We do have also counselors. We have a behavioral department that can help us also for family of patients that might be affected by this condition. And of course, what we do is also a lot of community outreach and education, because it is key to now find patients that might be in the early stages of the disease. And I think it's something key that we're trying to achieve, meaning before we were thinking that Alzheimer's disease, if somebody starts having just a little bit of memory problems, you just watch it until that condition was progressed to having enough symptoms that we needed to use medication to maybe cause some sedation, to be able to maybe to help with some of the agitation, hallucinations, things like that. So it was probably something that was not into people's radar to go right away to the doctor. It was, oh, you're aging, we don't need to see the doctor, it's part of your aging. Now we do. Now it's important to determine if this is actually coming from Alzheimer's disease, because now we do have at least one tool that can improve the quality of life if we catch it early.
Well, as I say, Dr. Cruz, those were all the questions I had. Is there anything I've missed out? Anything else you want to say about the work of you and your team here?
I'm just happy to say that I'm very proud of all the work at DHR. I think that being able to provide Leqembi, the first FDA-approved medication for Alzheimer's disease, so early after being approved, it just reinforced the commitment we have for our community and for our patients of bringing the best of what we have to the Rio Grande Valley. So this is our mission, is what drives us. So I'm very proud not only of our medical team or staff team, but also our leaders and administrators, which they do listen to what the community needs.
Thank you, Dr. Cruz, so much for today's interview.
My pleasure.